Well, levels of flu, RSV, and COVID are still high in Douglas County, but use of a one-size-fits-all test is helping doctors track down the tripledemic. 3 News Now reporter Alex Whitney has the details tonight.
Trying to keep from getting sick has been a tough task in Omaha lately, and it's not just one bug that folks have to watch out for.
We have seen quite the surge of cases of initially RSV, then COVID, and now Influenza A, especially with COVID cases on the rise yet again.
Douglas County, like much of the country, is in the midst of what's being called a tripledemic. Last week, the Douglas County Health Department recorded more than 1,000 cases of Influenza A. COVID numbers have been delayed due to the winter storm, but last week's numbers show the community has already topped the number of positive cases seen in this summer's Omicron wave.
On average, we're probably running about 50 to 60 patient tests a day with our COVID, flu, and RSV testing.
One increasingly common tool for tracking the tripledemic has been PCR testing. PCRs can test for RSV, Influenza A and B, as well as COVID at the same time, and for COVID, a PCR test is far more accurate than at-home tests.
This is very useful because fortunately we are able to treat for influenza and COVID-19 depending on each person's circumstances.
Rapid PCR tests can give results within hours, cutting down the time it takes from diagnosis to treatment. They do require a visit to your provider, and they do require sticking something up your nose. But thankfully, the test doesn't take long.
It is a little uncomfortable, but fortunately it's a very quick test and this takes mere seconds.
In Omaha, Alex Whitney, 3 News Now.